Okay, well, you know what that music means, that tonight we have another episode of The Younger You, and Troy and Dr. Thompson are going to sit down and talk about how a facelift can make you feel as good on the outside as you do on the inside. Check it out.
Thanks, team. Well, tonight's show is all about facelifts. We're doing two procedures. Take a look at tonight's episode. Okay, tell me the difference between a mini facelift and a full facelift.
There are many categories and subcategories of facelifts.
Let's talk about that.
I was blessed with my mom's hereditary, and she had a lot of wrinkles and sagging early. And I always thought it was because she smoked, and I have never smoked in my life.
The last couple of years, I've really noticed that, you know, the reflection, in pictures, I wasn't big on having pictures taken because I just wasn't seeing the person that I felt like.
Welcome to the show, Dr. Thompson.
Hi, Troy. Good to be here.
Okay, we love it when you do several procedures in the one episode. You're doing two different types of facelifts tonight. It's the Max facelift and a regular facelift that we understand in the public.
Right.
What is the difference, and why do you love the Max facelift so much?
Well, I love both procedures, and if I was completely honest, I would tell you I actually push the traditional facelift more often, which is also much different than the average facelift. There's a huge variety and variation between what people do for facelifts. But for me, the difference between the two is the MACSlift is done in an office setting with the patient completely awake. We're chatting during the procedure, and it's intended for mild to moderate facial aging. So this area right here, the jowl area, usually if there's a lot of laxity in the neck, I don't usually recommend the Max facelift.
Okay.
The traditional facelift that I do has a longer incision, and it's really intended to lift the entire face, including the cheek, the lower face, and the neck as one unit.
Okay.
And that's one reason I like it a little bit better, because I think it's a little bit more of a kind of a comprehensive, natural way to lift the face.
Like it's an overall lift.
Yes, but
that
not
could be
everyone
a new
needs
name.
it. Yeah.
You should tag that
overall
name.
lift.
Overall lift. Dr. Thompson, when someone comes into you, I'm going off my cues a little bit, I'm sorry. When a patient comes into you, how do you start the conversation off with them saying, this is where you should be with the procedure, this is what you're recommending?
Right.
Because they come in with rose-colored glasses.
Just yesterday, I had a patient come in my office, and she was specifically interested in the Max facelift. But she was in her late 60s, early 70s, really a lot of loose skin and laxity and soft tissue descent and a very loose neck. And then we just kind of had the discussion, you know, these are the limitations of the MACSlift. It really won't fix all of the issues that are going on with you. And so I kind of steered her more toward a more comprehensive lift. Sometimes people will come in for a facelift, and I say, you know what, your brow is really heavy. We should also consider lifting your brow at the same time. Dr.
Thompson, thank you so much for coming in. We really appreciate it. Tonight is very exciting. Two facelifts, one episode, one fantastic surgeon. Dr. Thompson, Utah Facial Plastics. If you want to find out more information about him, head over to theyoungeryou.tv, and I know you're going to love tonight's episode. Back to you in the studio.
Okay, everyone, be sure to check out that episode of The Younger You tonight at 9:30. It's also going to be airing on Saturday as well. And you also need to check out these really cool Utah's own products that Nisha and Michelle have over in the den. What's going on?